Welcome dear student. We are in the third week of this online course on management of waterborne disease. So in last few lecture series on management of waterborne disease, we have discussed bacterial disease of waterborne, bacterial disease which transferred through water. So today we are going to discuss about waterborne disease which is caused by protozoa, that is Giardia lambiella. Giardia lambiella causes the giardiosis in human. These protozoans causes disease only in human. This protozoan was discovered by Anton van Leeuwenhoek in his own stool sample. So later on, two scientists jointly, Lambel and Gardner, both who jointly named this parasite as Giardia lambiella. So this parasite, these protozoans exist in two phases. So one phase is called as trophozoite phase and another phase is called as cyst phase. So you can see in the slide which will be display on your screen short after this complete during this video. So you can see cyst and the trophozoite form. So trophozoite form is look like a tennis ball racket. Its size is 14 into 7 micrometer in diameter. There is a disc present and two nuclei are present in trophozoites. So when we talk about the cyst, there are four nucleus. That nucleus is present in cyst, which is separated by exostyle. So now we discuss the pathogenesis. So active infective stage of Giardia pathogen is the cyst. So cyst is ingested by human through contaminated food or by water. When it enters into the intestinal tract, this parasite binds with the duodenum of intestine by its disc, and this pathogen disrupt the absorption of fat molecule from the body, which leads to cause the steatorrhea, is the condition where the patient releases his stool sample with oil. So this clinical condition can also be comprises with fever and anemia to the patient. So now we discuss the epidemiology. So epidemiology means distribution and occurrence of pathogen in a particular area. So this disease is endemic in its epidemiological status, and the frequency is more in rainy season. So those villages in India, those who reside on the bank of river, they are more vulnerable to this pathogen. So the death rate of giardiasis is very low. That is, mortality rate is very low and the morbidity rate is high. So morbidity means infection, not death due to pathogen. So this giardiasis occurs more in children as compared with the adult. So this is one of the condition we can think about the when we think about the giardiasis. Another important thing related with giardiasis is, giardiasis is waterborne disease, and proper sanitation condition will improve the incident of the disease. So now we discuss about the laboratory diagnosis. So laboratory diagnosis can be carried out by examining the stool sample of the patient by using microscope. In microscope, if the stool sample contain a trophozoite or cyst form, that indicates that the patient is suffering from giardiasis. Another diagnostic method is detection of antibodies from serum of a patient, which also lead to shows the presence of gigardiasis in a body of patient. So treatment, we can say there are many protozoal treatments are available for gigardiasis. Trinidazole, then metronidazole. These are the anti-protozoal drugs used to treat the patient. So prevention is always better than cure. So one should take personal hygienic and good sanitation condition at home. In my previous lecture, I told you many times that boiling water for 30 minutes can leads to kills all the pathogen which present in the water. So water filtration at home is one of the best remedy to get rid from this protozoal parasite. Then your utensils or other home appliances should be clean before use. So if you take this small care during rainy season, you will protect yourself as well as your family member from the menace of gigardiasis. With that, today we conclude the short lecture on gigardiasis. Thank you very much.